Well, October is National Breast Cancer Awareness Month. It's a cancer that affects millions of Americans, and hundreds of thousands every year are diagnosed with it. And joining me now live in the studio is Dr. Elsa Kuhl from U of L Health. Thanks so much for being here, doctor. And we want to start off by talking about any risk factors that would make someone more prone to breast cancer than someone else.
Yeah. So there are a lot of risk factors for developing breast cancer.
Okay.
The biggest one, believe it or not, is just being a woman. Getting older also increases your risk, and then also having a strong family history definitely increases your risk for having breast cancer.
Okay, so getting older, talk about that. I've heard about like dense breasts and how that can also increase the risk.
Yeah, so dense breasts, our breasts are made up of both fatty tissue and glandular tissue, and the more of that glandular tissue you have, the harder it is for us radiologists to read your mammogram.
Okay.
And breast cancers can hide in really dense tissue.
And so what are some of the symptoms and signs that women should be aware of? And actually some men have gotten breast cancer as well, right?
Yeah. A lot of the breast cancer that we diagnose actually have no signs or symptoms, which is why screening mammograms are so important, why screening mammograms save lives. But if you do have any symptoms of your breast, whether it be a new lump, either in your breast or in your armpit area, if you feel like you've noticed any skin changes in your breast, or if you've noticed that your breast has increased in size or significantly decreased in size, those are all reasons to come see a breast radiologist to be worked up for breast cancer.
I know when some of the COVID shots were going around, there was talk that that could be a false, a lump in your breast, but is no matter what, if you feel something, you should probably get it checked out, right?
Yes, I always tell patients it's better to be safe than sorry. You can't tell just by feeling or looking at it if it's cancer or not, and we really don't know until you look at it with imaging.
At what point should women, start the screening and self-exams and continuing it as they go on, as they get older?
Yeah, for the average woman, they should be starting mammograms yearly at the age of 40. For patients who are higher risk for breast cancer, meaning they have either a genetic mutation that increases their risk for breast cancer, or if they have a strong family history, they may qualify for earlier screening. And then when it comes to self-exams, I just tell patients, be really familiar with how your breasts look and feel. If you notice any changes, talk to your doctor or make an appointment with a breast radiologist to get worked up.
Okay, and I was just asking you because I was curious, at this time of year we have so many walks and different things to bring awareness about for Breast Cancer Awareness Month. Do you have more people coming, more patients coming in just wanting to make sure that they get checked out this time of year?
For sure, it's a very busy month right now, so we encourage any and all patients to come in, but come in at any time, not just October.
So the awareness is working?
It is.
Very good. Doctor, thank you so much for being here. We appreciate it.
Thank you for having me.
All right, well, up next, the